We're also seeing health systems entirely distorted and changed and reframed around commercial interests rather than public interest. So we're incredibly concerned about those trends. We need to expose them. We need to expose who's benefiting from this, but also the harms being caused in low and middle income countries. So my name is Marriott. I am a Senior Policy Advisor for Oxfam, and I'm the Health Policy Manager for Oxfam International. So I think we've been tracking this issue for a couple of decades. We've seen over that time an increasing role and power and influence for corporate actors, for private finance, for private individuals in the global health space. And we're incredibly concerned about accountability deficits, that there is insufficient accountability of how their power is playing out in the global health landscape. So we think it's incredibly important to interrogate that, to explore it, to research it. And I suppose what brought me here is to kind of learn from other people and to figure out together what we can do to challenge those accountability gaps. So an area that we've spent a lot of time looking at is the role of development finance. So development finance that's supposed to be expanding access to healthcare, expanding equity in healthcare, achieving universal healthcare. We're seeing increasing partnerships with private finance and private equity funds in particular. So we've tracked investments into private hospitals in low and middle income countries. And what we found is very disturbing. We found cases of patient rights abuses, inflated medical bills, people being pushed into poverty by these costs associated with profit-making enterprise in healthcare. And we're also seeing health systems entirely distorted and changed and reframed around commercial interests rather than public interest. So we're incredibly concerned about those trends. We need to expose them. We need to expose who's benefiting from this, but also the harms being caused in low and middle income countries. So I think we need a real coming together of different disciplines in this, and this is why this event is so important. We need to investigate and research more what is actually going on, what actors are involved, where conflicts of interest are taking place and in what places. And so, looking at different multilateral partnerships, different global health partnerships, what is the influence of these private actors in decision making in those? What mechanisms can we identify to hold them to account? How can we push for more transparency in those governance relationships? So I think it's accountability, I think, is a broad term. There are legal mechanisms, there are holding governments to account for these decisions, but there is also a lot of pressure that we can put on via exposing what's happening and coming together in a more united way to present these concerns to decision makers. Well, I think first we need to diagnose some of the problems here, because a lot of what is going on is hidden, it's not discussed, it's not debated, and people just don't know about it, including parliamentarians, for example. And I think parliamentarians have a really important role at the national level to hold their governments to account, but also to push their governments to ensure that there is better governance, accountability and transparency within these multilateral partnerships as well. So I think the first big step is identifying the problem, showing that there is a problem, and communicating with all of those stakeholders about what the sources of that problem is. And then I think it really has to be a united effort to bring together researchers, civil society, as well as government officials, policymakers, to come together to agree on that problem and then to look at those avenues for holding private sector to account in this space. I think most fundamental is remembering what we're trying to achieve here and what governments are responsible for achieving: the right to health, the commitments they have made to achieve health for all. We need to analyse much more closely how the vested interests of corporate players may be working against those interests and hold governments to account for them. So we're very concerned about the impact of commercialisation and corporatisation of healthcare on women in particular. We know that women's health needs are often not as profitable or not seen as profitable. So we've seen it in the commercialisation of healthcare systems in India, for example, women's bodies being exploited in that process for profit, but their general needs being neglected. We're also seeing that women are facing higher out-of-pocket costs in commercialised settings, and because of the higher costs associated with commercialised healthcare, they're often entirely denied healthcare, so disproportionately negatively impacted by these trends. Yet at the same time, when we look at the frameworks used by international actors on gender, they're so narrow. So the development finance institutions that are investing in these private hospitals simply count the number of women employed in these hospitals, or the number of women patients. Not even that. It's so narrow, and there is a complete lack of absence to see how the commercialization of these healthcare systems is itself exacerbating gender inequality in so many different ways. So to date, I think this is a very neglected topic from the bottom to the top, and it has become very tokenistic to slap on a gender badge onto an investment, for example, without looking at the kind of deeper consequences for women and for gender inequality. So I think a symposium like this can be quite bleak when we're looking at all the different powerful forces that may be working against our goals. So it is difficult to remain hopeful. What gives me hope from this event and in my work is all the amazing people that have committed their lives to health justice, who understand these issues, who work so hard to produce amazing research, amazingly powerful research. And I think my belief in the strength of coming together as a community to work together and to find new ways to hold our duty bearers to account. So I think it's the people that give me hope, as well as a broader understanding across humanity of the importance of health. I think everyone gets why it's so important to achieve health for all. It's the most precious thing that we have, and everybody understands that. So that's what gives me hope.